Hi, I'm Bethany Zell. I'm the Program Director for Healthy You at Cary Medical Center, and welcome to our Wellness Wednesday Live. Today, our topic is blood pressure do's and don'ts, and that goes right in line with our February theme for the Healthy You program, which is heart health. We're kind of collaborating with the national campaigns for Heart Health Month, and so we're right in line with that. And we're really thrilled today that we have Nancy Holmquist, who is the program coordinator for our Siruno stroke prevention program here at Cary Medical Center. And she has recently gone through a training on proper blood pressure taking techniques and has learned a whole lot about what we can do as consumers to really make sure that our reading is going to be the best possible reading that our providers can get or that we can get when we're taking it at home, and sharing with us some of the things that we might be doing that could contribute to an inaccurate reading. And I was really surprised when we talked about some of these things.
Right.
I had no idea. So I'm going to turn it over to Nancy, and we welcome you to ask any questions if you're on here live. We're going to share some other information with you afterward about maybe some of the things that Nancy brings up, but we're just going to have a conversation about some of the tips and tricks and different things that she's recently learned through her trainings for our Siruno stroke prevention program. So Nancy, thanks for being here.
Good afternoon. Thank you, Bethany. And she's right. I did recently take a training or participate in a training for learning how to take blood pressures, and also to perhaps be able to set up a self-monitoring blood pressure program in the area. But during that training, I was given a handout excuse me, about the do's and don'ts with taking or having your blood pressure taken. And it doesn't matter if you go to your doctor, your dentist, your eye doctor, everyone is taking a blood pressure these days. And you know, I don't always know why. I'm not sure we all know why, except that it's part of what they do for overall wellness from their area of expertise.
Because it can indicate other conditions, right?
Absolutely.
It can kind of be a precursor for some things.
Yeah, we're talking about this because February is the Heart Health Month, and we're in our red, and also it's important in this area because Aroostook County has had some pretty high numbers with the incidence of high blood pressure and cardiovascular diseases. And so I think as healthcare consumers, it's important for us to know a little bit more about what's happening to us when we enter into, let's say, our medical provider's office. So, first of all, in November of 2017, the American Heart Association changed the guidelines for what's considered a normal blood pressure or high blood pressure or elevated. And so the numbers are actually lower than what they were. So what I mean by that is a normal blood pressure, the top number or the systolic number, is less than 120, and then the bottom number or the diastolic is less than 80. And I think in the past you could add 10 to either one of those. And so the elevated high blood pressure or hypertension stages or the serious hypertensive crisis, those numbers were all lowered also. And when that happened, many people thought, okay, everybody's going to be on blood pressure medication, but that's not the case. The American Heart Association would have done extensive research to make those determinations. And I think it also says that hypertension or high blood pressure is a very serious condition. And just because someone might be on medication does not mean that they have nothing to be concerned about. So the do's and don'ts of having your blood pressure taken. The first thing I would want to say is when you go to the doctor and they want you to, or they want to take your blood pressure, there are some things that you should maybe know that will help you to feel comfortable that you are getting the best reading possible for where you are at that moment. And I think the other thing that's important is that you speak up. As consumers of healthcare, we have to be able to speak up and ask questions or say, no, I don't think that's right for me, and be our own advocate. I think the days of going in for a very long appointment and the doctor knowing almost everything about you or the provider knowing everything about you are past. And that does not mean they don't care about us anymore. It just means that their lives are dictated by variables that mean that they have to come in, tend to us, and leave quickly. So I would like to just start by saying that when you are asked or when you're going to have your blood pressure taken, that you be sure that you are sitting with your back supported, feet flat on the floor. Do not cross your ankles. Do not cross your knees.
Oh, so I shouldn't be sitting like
no,
slouchy?
Bethany.
No.
I would. That would not be good.
All right.
But I think it's important to know that if you are not sitting with your back supported, that could make a difference of 6 or 10 points on the top number for your blood pressure. So you want to be supported.
Okay.
Not having your feet flat on the floor can make a difference of from 2 to 8 points. The problem that I experience, because I'm not very tall, is I can't always sit with my back up against the back of the chair and get my feet
flat
to the floor. So I sort of figured that it's probably better that my feet are on the floor and that I'm sitting up straight. But if you're tall, then you're okay.
Make accommodations.
That's right. Now here's one that I absolutely did not know, and that is whether or not you have a full bladder. That can make a difference of up to 10 to 15 points on the top number of the blood pressure and up to 10 on the lower number.
Wow. I had no idea.
I had no idea either. And so obviously you should empty your bladder before
Stop in the restroom
the
on
measurement. And if you drink coffee or you smoke a cigarette before you go in, that can make a difference from 6 to 20 points in your overall blood pressure.
So if you go in there with bad posture, a full bladder, and you just had your coffee, I mean, you could really be having very inaccurate numbers.
You could have inaccurate numbers, and yes. Talking and moving your hands, hand gestures while you are having your blood pressure taken can affect those numbers from 7 to 10 for the top number and up to 10 for the lower number. So don't talk.
And that's hard. Sometimes like the nurses will engage you as they're taking your blood pressure and they're chatting you up, and I had no idea.
That's right.
You should just tell them, I'll chat with you in a minute.
And they might, we might know them. We live in a small area. It's
for sure
possible we know who's taking our
in the
right,
doctor's
we
office.
Want to talk about it. But I think what's safe is if they are using a stethoscope and the cuff, they are so busy listening to the stethoscope that they're probably not willing to engage. But if it's an automatic device, then it's easier to get distracted and to begin to talk. I think it's also important that we remember that a blood pressure should not be taken over clothing. That can make a difference from 5 to 50 points. So here it is, winter in northern Maine, and most of us head out with a layer and a layer. And if we are going to the doctor, even though it's a pain, it would be very important to pull your arm out. Or let's say I had an appointment today, instead of wearing a long sleeve shirt underneath my sweater, put on a short sleeve t-shirt, and then my arm is available.
So is it like if you just yank up, would that interfere with getting a good reading if it were tighter around?
If it's very tight, I think it probably would. But you could certainly pull your sleeve up. But in the doctor's office, you do have the privacy of the room, and so you would be able to do that. Yeah. It's important that your arm is supported. Now, supported on a surface like the desk, or in this case, I've got it on the table, but not to be supported by the nurse or whoever's taking the blood pressure, not by their arm. Your arm should not be tucked under their arm. That's not the kind of support we're talking about. That can affect the blood pressure from up to 10 points, either the top or the bottom. I don't know if it's even possible for this to happen, but actually you should be sitting for about 5 minutes quietly before the blood pressure is taken. And it might be that the initial questions that may be asked of you when you go into the provider's office might give you that 5 minutes to rest. If they take it right off when you first arrive, then you haven't had that chance to relax. And something that happens to a number of people, and some people don't even realize that they are affected by it, and that is the white coat effect. In other words, just the fact that they have to be in the doctor's office or provider's office, and they're having their blood pressure taken, or you might have to have an injection, or you're very sick. You think you'll get bad news. Just the fact that somebody comes at you with that's in that official capacity can make people very nervous, and that can affect the numbers from 11 to 30 points. So why is this important? Because if your numbers are up there and they're high, it may be recommended that by the end of your visit, the doctor may recommend medication for you. Maybe you need to have that, and maybe you don't. Of that, I think is important for all of us as we are involved in our own health care, and certainly don't be afraid to say something like, no, I don't, that chair isn't fitting me right. In my own experience, I remember being in a provider's office, and they asked me to your blood pressure, know a lot of those basics, but they are busy people too, and with all due respect, they cannot remember all of these different things.
And the other thing too, I mean, if you do get a really out of the ordinary reading at the beginning of an appointment, it's fair for you to ask for it to be rechecked. maybe after you've met with the doctor and your nerves have calmed a little bit, or a little further into it when you've not been rushing to get into your appointment. You might not have had that 5 minutes that Nancy talked about. If it's something that's unusual for you to have a weird off reading, don't hesitate to ask for it to be rechecked before you leave the doctor's office. If you think that there might be a concern, or you think that maybe there wasn't an accurate reading the first time around, because blood pressure can change.
That's right. And I'm glad you mentioned that, Bethany, because one of the other things that you should always ask is, what was the reading? Sometimes they take the reading, they write it down, and don't think to tell you. And if you don't ask, you might not know.
Yeah.
And so if you don't have a general idea of your own reading, then you may not know if it's quite a bit higher than what it was the last time you had it taken. At my recent appointment, my blood pressure was a little higher than it usually is. And
but you knew
then I remembered what I had gone through to get to that appointment on time, and the winter roads and all of that. And, you know, I was disturbed by the fact that it was a little higher. But
it made sense.
It made sense. It absolutely made sense. The stress level is always underlying for everything. And
wonderful.
Yeah.
Well, thank you so much for that great information. And again, stay tuned with us all month long as we continue on the theme of heart health. Our next Wednesday, Wellness Wednesday Live, will be in 2 weeks, right at 1 o'clock. And we're going to have Dr. Hans Duvefeld from Pines Health Services, who's going to talk all about getting to the heart of your health. So we hope you'll join us back here again in 2 weeks. And thank you so much for sharing this information with us, Nancy.
Thank you.
Again, we'll be posting some other information that she shared with us today, just so you have it a little more easily accessible to reference. And thank you so much for joining us. Have a great day.
Thank you.